Hello everyone, we welcome you back to our YouTube channel. Today we'll be discussing about the Navodaya, Vidyalaya, Samiti NVS Nursing Officer 2022 official answer key. This official answer key was released 2 days back and the exam also was held recently only. So we'll be solving about 20 questions today. The first question is, which of the following abdominal quadrant does the stomach situated? Stomach is situated in which quadrant? Right lumbar, left hypochondriac, right hypochondriac, left lumbar. You must have already guesses the answer. Which one is the answer? Is left hypochondriac region. Actually, as per this ninth quadrant, the exact location of the stomach is in the epigastric, but there is no option given in the epigastric, so the nearby location is left hypochondriac. As we all know, the stomach is located on the left side of the abdomen. So next question. Which area does the medication act on buccal administration? Option A, mucous membrane. Option B, muscles. Option C, blood vessels under the tongue. Option D, dermis. You might have already guessed the answer. The correct answer here is A, under the mucous membrane. Kindly note, it is not under the blood vessels under the tongue, but it is on the mucous membrane. Correct answer here is A, mucous membrane. Next question. What is delusion? This is a very simple question. False sensory perception. Option B, fear of a specific object or situation. Option C, a state of mental confusion and excitement. Option D is a false personal belief. Option D is correct answer. This is a very simple answer questions. I hope you all know the answer. How many pairs of cranial nerves are present in a human body? 12 pairs, 31 pairs, 15 pairs, 10 pairs. You might have confused about the cranial nerve and the vertebral column here, because there are 31 vertebrae are there. You might be confused with A and B. The correct answer here, there are only 12 pairs of cranial nerves. We'll discuss in brief about them. The first one is olfactory. They use as which of the following is the first cranial nerve? Olfactory. Optic, second oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal. The 10 also, which of the following is a 10 cranial nerve? They used to ask like that, so you should know the answer is vagus. 11 accessory hypoglossal. We should know also the nerve type, whether they are sensory or motor and their function. Next question. What is the normal weight of the placenta at term? 300 gram, 500 gram, 1000 gram, 800 gram. The correct answer here is B, 500 gram. This is a very interesting question. I rarely see this question comes in the exam, but we did discuss this, we did study it in the first year in the psychology. In the psychology and the pediatric, actually third year. Who proposed the 6 stages of moral development? Option A, Anna Freud. Option B, Piaget. Option C, Sigmund Freud. Option D, Lawrence Kohlberg. The answer here is D, Lawrence Kohlberg. We'll be discussing in brief about this. Let's see what is this Lawrence Kohlberg model. Stage 1, there is avoiding punishment. Stage 2, aiming at a reward. Option C. Stage 3, good boy and good girl attitude. Stage 4, loyalty to law and order. Stage 5, justice and spirit of the law. Stage 6, universal principles and ethics. The stage 1 and 2 is fall under pre-conventional, whereas stage 2 and 3 is fall under conventional and post-conventional. You can always read in details if you want to know more about this moral developments theory. Next question. This is also a very commonly asked questions. Which of the following is the primary target of HIV? CD4 plus T cells, B lymphocytes, plasma and memory cells, D transitional B cells. Correct answer here is A, CD4 plus T cells. HIV effects or primary target of HIV is CD4 T cells. Next question. This is a interesting question actually. This one I have heard it for the first time after I've seen this questions, after I have seen this NVS exams. What is the purpose of Loweth scale? Loweth scale. Option A, assessment of cardiovascular system. Option B, assessment of respiratory system. Option C, assessment of integumentary system. Option D, assessment of musculoskeletal system. You might have already guessed the answer, but the correct answer here is D, assessment of musculoskeletal system. We'll be discussing in brief what is this. This assessment Loweth scale is a parameter that commonly used by the doctor or therapist to determine the muscle strength of the patient's hands, especially post-stroke patient. It is commonly used for post-stroke patients. We'll be seeing what is this scale about. This is a muscle strength assessment, muscle function level. Grade 0, no evidence of contractility, and a percentage is 0. Loweth scale is 0. Slight contractility or no movement. Grade 1, percentage 10, and T level scale is Loweth scale is T trace. So next level, grade 2 is full range of motion, gravity eliminated 25%. P poor, full range of motion with gravity. Grade 3 50%, and F, that is fair, full range of motion against gravity, some resistance. Grade 4 75%, and grade Loweth scale is G, good, full range of motions against gravity and full resistance, that is grade 5. 100%, that is normal. Normal is grade 5, whereas no evidence of contractility is grade 0. So know what is Loweth scale. Next question. This is also a very commonly asked question. Which of the following diagnostic test is used to detect neural tube defects? Option A, maternal serum alpha fetoprotein. Option B, percutaneous umbilical cord blood sampling, PUBS, ultrasonography. Option C. Option D is contraction stress test. The correct answer here is A. You all must have known the answer here. Next question. What is called the comprehensive assessment of an entire community? Option A, health program. Option B, health for all. Option C, community diagnosis. Option D, 5-year plan. The correct answer here is C, community diagnosis. Please note that this all are official answer given by the NVS. Is there in their official website. If you have appeared this exam, kindly enter your ID and passport. You will get this official answer. What is called perfusion in physical examination? Option A, act of tapping. Option B, act of touch. Option C, act of listening sounds. D, act of observation. Percussion is option A, act of tapping. I think we all know this. Percussion is a first year physical examination. What is called acropathy in hyperthyroidism? This is not a very commonly used word. Option A, softening of the bones. Option B, digital clubbing and swelling of fingers. Option C, enlarged thyroid glands. Option D, protrusion of eyelids. The correct answer here is B, digital clubbing and swelling of fingers. We already post it in Facebook about this MCQ, daily MCQ. We are uploaded in Facebook. If you are there, you might have already seen it. Some of you might have already give the correct answer. So digital clubbing and swelling of fingers. So this thyroid acropathy is present in grave disease, about 1%. If there is a triad of digital clubbing, remember there is a triad, that means 3 symptoms in acropathy: digital clubbing, soft tissue swelling of hands and feet, and periosteal newborn formation. Question might come, which of the following is under the triad of thyroid acropathy? Remember, this is 3 symptom. Next question. This is also very common, very simple questions. How many bones forms the axial skeleton? 206. As we all know, skeleton is divided into axial and appendicular. Total number of bones is 206. Obviously it's not A. Option B 80 might be. Option C 126 might be. Option D I wrote A 90. Alright, so the correct answer here is B, axial. Normal number of bones in adult is 206. Out of that, 80 are axial and 126 are appendicular. So axial bone, we'll see these are the axial bones here. 80 are the cranium 8 in the skull, cranium and face. There are 18 plus 8 plus 14. Skull and associated bones are 29. That is auditory, ossicles, hyoid bone, sternum, ribs, and here thoracic cage 25, 26 sacrum. Kindly refer books if you want to know the details about these bones, axial bones. Which of the following is the process of providing which of the following is the 14th question? Yes, which of the following is a process of providing information and motivation regarding healthy habits and lifestyle? This is a very common simple questions. Option A communication, option B epidemiology, health for all, option D health education is correct answer here. Next questions. What is called an olfactory hallucination? False perception of smell, or a false perception of sound, perception of things, false perception of vision. The correct answer here is A. All might have already known this answer. It's a very simple one. Next question. In which of the following does immunity occurs naturally through the transfer of immunoglobulins across the placental membrane? Option A antigen, option B active acquired immunity, option C innate immunity, passive acquired immunity. Immunity is a very commonly asked question. It's a favorite questions of almost all seminar examiners. So before writing any questions, kindly read in details about the immunity. Correct answer here is D, passive acquired immunity is a correct answer. This is interesting questions. Which of the following germinal layer that develops into bones actually here, into bones, cartilage, kidney and pleural cavity of fetus? Option A mesoderm layer, option B ectoderm layer, endoderm layer, and option D is the periderm layer. Correct answer here is A. The correct answer here is A, mesoderm layer. We'll be discussing in brief about this germinal layer. This is the germinal layer. As you can see, there is a yolk sac. Yolk sac is a amniotic cavity containing amniotic fluid, amnion, endometrium. This is maternal side, maternal blood pool, chorion, allantois. In ectoderm layer becomes, it is converted into digestive system, liver, pancreas and lungs. Lungs only the inner layer, kindly note that. Whereas mesoderm layer becomes circulatory system, lungs, skeletal system, muscular system. The question asks about the lungs and kidney, and kidney falls under they didn't mention here, but skeletal system, the bones they mentioned in that question, so it fall under skeletal system. So mesoderm is correct answer. Whereas ectoderm layer becomes hair, nails, skin and nervous system. Ectoderm is the outermost layer, and it develops into the peripheral parts of our body, that hair, nails, skin and even nervous system. Next question. Which of the following is called an obsessive compulsive disorder? Option A, bipolar disorder. Option B, repetitive thoughts and behavior pattern, false perception. Option D, recurrent failure to resist impulses. Correct answer here is B. It's a very simple question. Obsessive compulsive disorder. Complete displacement of the articulation surface of vagina is called sprain, strain, subluxation. D, dislocation. Correct answer here is D, dislocation. The last question. Infection transmits directly from mother to an embryo or fetus or baby is called option A, inoculation. Option B, droplet transmission. Option C, vector borne transmission. Option D, vertical transmission. The correct answer here is D. Vertical transmission is an infection which transmits directly from mother to an embryo or fetus. This is it for today. We'll be solving 30 more questions related with this NVS exams. So thank you. Kindly like, share and subscribe.